When one is talking about transformation, there are a number of factors that I think are important. Number one, you need to articulate a vision for what the organization needs to become. People need to understand how what they're doing on a day-to-day basis is going to relate to what the organization wants to eventually become. Second thing is that you need to empower employees to make change. You need to have a performance management system with metrics that can help people judge how well they're doing in terms of transforming the organization. In our transformation within the VA, starting back in 1995, the setting up of an organizational unit that was small enough to manage, called the Veterans Integrated Service Network, and decentralizing power down to that unit was a very important part. In healthcare, you need to have good information, and an electronic health record is essential in our minds for leading a transformational effort. It provides for the data and the information to measure the kind of progress that you're making. It doesn't take a day or a week or a year or 2 years. It takes a long period of time to really change and transform the culture of an organization, and you need to have a constancy of purpose over that period of time. Well, if you look at again, the transformation of the VA that started back in 1995, all of these principles that I just talked about were applied. Not consciously always, and not thinking that they were essential, but when we look back at the effort, it's clear that those principles that were, and those programs that were applied were fundamentally important. If I had to pick out one or two that I think were really important, one would be the setting up of this structural organization of the networks, which were small enough to manage, and the decentralization of power down into those networks from our central office in Washington were two, I think, fundamentally important things that we applied during that transformation. Several things that have struck me in my 10 years of contact with the National Health Service. One is that there's continuous reorganization, it seems. And I think we found that the stability of our organization, the fact that we've got the same structure that we had 15 years ago, has been important. I think that there is much that could be decentralized. From what I understand, there is still a feeling that the system is, quote, overbedded. And so a reduction in the inpatient beds with the concomitant outpatient services to pick up that load probably would be a thing that ought to be looked at.